You need to send me the link.
Okay, first of all, I'm gonna give a PO medication. I don't have any POs, but I'm gonna check my mark, okay? It's gonna have, say, Lasix 40 milligrams PO, for example, okay? I'm gonna go back and check my physician's order. Yep, there's Lasix 40 milligrams, okay. So, my first check, I'm getting it out of the drawer. Medicine cup, we'll just pretend. All right, okay, here's my Lasix 40 milligrams, okay? We're gonna put it in a cup. We'll just pretend it's in a cup, okay? I've checked it. Yep, that's Lasix. Yep, that's Lasix, okay? That's my first check. Physician's order, second check is here. Third check, I'm about to put the Lasix back in the drawer or else discard it, whatever, the package. Third check. Fourth check, okay, I'm going to take the Lasix in the package. Okay, remember, it's going to be in the package. Why?
That way you can check it again.
You can check it again, or what if that patient refuses? Okay, it's in the package, and I'm walking down the hall, and I'm in my patient's room. Miss Gilchrist, I have got your Lasix here with me. I don't take Lasix. I have to go back and double check. That's why it's not packaged. She says, yes, I take Lasix. Okay. Miss Gilchrist, do you have any allergies? I've checked her name band. I've checked her date of birth. At least 2 identifiers. Do you have any allergies to Lasix or anything like that? She says no. Okay, I'm checking it again. Okay. Yep, she gets Lasix. I give it to her. I give her about 15 cc's of water, 30 cc's of water. She takes it. I stand there while she takes it. Then I leave and I come back out to the medication cart. Then I document that I gave it. Okay? POs are not hard. Okay? Any questions on POs before I move on? Okay, NG tube, almost the exact same procedure. Okay, I'm going to check it with the physician's order. Okay, and then I'm going to get it out of my drawer. I'm going to check it again. All right. I'm going to go ahead and probably crush it at this point because I can't crush it in the room. Or like I told Dawn, what you could do is go to the room. If the patient can speak for herself or himself, ask him, okay, Mr. So-and-so, I've got your Lasix. And he says, yes. Then I'm going to come back out. I've identified him by birth date and name band. I'm going to come back out, crush it. I'm going to take it back in and give it. Because you can't crush in the room. That's the only problem. Most places have these big honkering huge crushers. And you can't take it in the room. So what I would do probably is check him, ask him for allergies, and come back out, crush it, mix it in the water, take it to him. Say, I've got your Lasix mixed in water here. Go ahead and elevate his head of the bed, checking his name band again. Okay, I'm always checking, always checking, always checking. Make sure I have the right one. We're talking, yeah, he's all right, he's doing good. Elevate the head of the bed. I'm going to check for placement. How? By checking the residual. If it's less than 5, not residual, pH placement. Excuse me, the pH. If it's less than 5, I'm in place. So I'm going to go ahead and flush with 30 cc's of water, milliliters. Then I'm going to go ahead and give that medication. And then I'm going to flush with 30 afterwards. Okay? If I have 2 medications to give through the NG tube, I'm going to flush with 30, give the medication, flush with, 5 to 10 cc's, and then give the other one, and then flush with 30 after that. Okay?
You crush them simultaneously, so you've asked him about both of them
Right.
while you're in there.
If I have 2 of them, right.
So Karen, the one you flush with 5 first and then?
No, 30, then you give it, then flush with 5 to 10 mils of water, and then give the second medicine, then flush with 30. So it's 30, 5 to 10, 30, if you have 2. Now if you have 5 or 6, you're going to do 5 to 10 in between each medication. Okay, does that make sense so far? Okay, then I'm going to keep his head up for a little bit afterwards, make sure that everything goes okay. I'm going to, yes ma'am. Okay, and then I'm going to come back out, go here, and I'm gonna document that I gave it. Never document before you give. Why?
Something might happen.
Something might happen, okay? Now, on the intradermal, is there anything I'm just gonna check off sheet so far that you can see?
Just the bowel sounds.
Oh, yeah, I'm sorry, when you're checking for placement, you check pH and check vowel sounds. I don't have my sheet with me. Okay, for insulin, darn. I have my NPH and regular. Okay, so what I'm gonna do at that point, look at my order, check against the MAR, and check against the physician's order. Okay? Once that's verified, I'm gonna pull my NPH, I'm gonna pull my regular out. Okay? Yep, this is Humulin R, this is Humulin N, or Novolog, whatever the hospital uses. Novolog, Humulin, all those are interchangeable. Okay, so whatever that facility uses, then use that one. So I've got my N and my R. Check this, I've checked it again, okay? What am I going to do before I give insulin? Check the blood sugar. I'm not so much concerned about the N, because that's long acting. I'm concerned about the regular that's gonna act in just a few minutes, okay? So I wanna make sure that it's okay before I give it. I have no parameters, but I'm going to use nursing judgment. Say if it's 70, I may hold it until he eats and then give it. Okay? All right, so I've got my N and R. Okay? I'm going to go ahead and draw up. Say I'm going to give 6 of N. I'm going to draw up this, clean it real good, and I'm going to inject air in. I'm sorry, I got to take it and roll it. Okay, roll my N. I don't have my insulin with me, so I'm kind of lost. Roll my N, inject my air first. Okay? Take it out, go to my R. I'm going to say I'm going to give 10 of R. Clean it real good. Inject it into the R and the air. Invert the regular. And draw up my 10. Okay? Go to my 10. Take it out. Clean my N real good. I might roll it again. You never know. Okay, then I'm going to put it back in. And I'm going to invert it and draw my 6. So if I give 10 and 6, what am I giving? 16. Okay. Okay, it's given. I have no air bubbles. I'm taking this and my MAR down to the room. Okay, I'm down in the room. Okay, Mr. So-and-so, your blood sugar was 154. I'm giving you your NPH and I'm giving you your regular insulin, your before breakfast dose. Do you have any allergies? Do you have any problems with taking your insulin? No, everything's fine. Patient identification, date of birth. Ask him who he is if he knows who he is. Always double check. Okay. He says, yes, it's okay. I can take it. I am going to clean. Kind of hold it up a little bit. Okay. 45-degree angle. I'm going in. Do I aspirate on sub-Q? No. Go ahead and inject it, hold it down, and come out. Okay? Come out of the room, go and document blood sugar and that I gave it. Okay? Anything I missed on that one? Drop my sharps. Okay, here's my sharps.
Well, just the things.
Huh?
Just right now.
Yeah.
So that don't matter.
Yeah, that would be on the procedure. All right, on IM, okay, Mr. Smith is hurting real bad. Okay, I get my IM, he gets, say, Demerol 25.